Welcome to the Gold Factor podcast, Summon Your Greatness, where we share insights and have impactful conversations with ordinary humans doing extraordinary things in the world. I'm your host, Bernardet Gold, high performance coach and biomagnetism therapy practitioner. If you or someone you love is struggling with health conditions, you're not going to want to miss today's episode. I'm so excited to have Dr. Luis Garcia as a guest today to share a revolutionary scientific and therapeutic approach to wellness that differs from traditional medicine, homeopathy, herbs, and natural therapies. Dr. Garcia is a pioneer and leader in biomagnetic pair therapy, also known as biomagnetism therapy. He provides a comprehensive training to practitioners and individuals that want to reap the myriad of benefits that biomagnetism provides. Dr. Garcia received his Bachelor of Science degree in biology from Boston College in 1997, where his genetic research landed him an international scientific publication. He received his medical degree in Columbia in 2005 and served as medical director and chief scientific officer of, and I'm going to butcher this name, Salud Futura Clinic in Bogota, Colombia in June 2010. Dr. Garcia is licensed to practice medicine and surgery in Colombia, South America, where he was recognized as one of the leading complementary and alternative medicine medical experts in areas which include cardiovascular disease, gastrointestinal disorders, diabetes, chronic fatigue, autoimmune disease, cancer, and other concerns associated with aging. So I would love to introduce to you Dr. Garcia. It's such an honor to have you with me here today.
Thank you very much, Bernadette. I'm happy to be here.
Now, I believe you began your journey with biomagnetism in 2008 with the founder of biomagnetism therapy, Dr. Goyce. Is that right?
Yes, that is correct. I was introduced to the concept by a colleague that I found at a conference, and he recommended and heard my story about how I was frustrated with conventional medicine. And, I had realized that unfortunately, conventional medicine tries to treat every symptom with a pill. And so they consider that for every ill, there must exist a pill. And I did prescribe analgesic medication for headaches and different pains, and then antibiotics for infections. But the infections kept coming back, and the headaches kept coming back, and the gastritis, and it was just frustrating. So I, was always searching for what else is there, and there's got to be something better. And I did homeopathy, acupuncture, ozone therapy, biological and functional medicine, you name it. And just I kept searching and searching. And one day I met this colleague, and he said, "Oh, you need to discover biomagnetism, and your world will never be the same after you do." And so I started looking it up that night, found some information on YouTube, and just was blown away. And a month later, I was in the course in Ecuador, and my life has never been the same since.
Wow, I'm glad you discovered it. So glad, because 2 years after incorporating it into your medical practice in Colombia, you returned to the US, right? And opened a practice that is devoted to biomagnetism therapy.
Yes. So once I went to the course, I was blown away. There was no denying that it was working. And I spoke to other medical colleagues that had come from all different countries in Latin America or Central America. And they were telling me about their experiences that they had been trained a year earlier, 2 years earlier, 3 years earlier, and that they were OBGYNs, they were internists, they were emergency room physicians, and they had discovered biomagnetism, and they were, applying it to some of their patients. And so when you hear other colleagues rave about this new therapy, I said, you know what? I gotta start, placing magnets on people when I go back to Colombia and in my own medical practice. And I need to confirm this for myself. Yes, I believe Dr. Goyce in the seminar, and I believe my other colleagues, But it wasn't until I started, practicing biomagnetism within my conventional medical practice that I was truly blown away. And originally, as you know, for a pneumonia, for a urinary tract infection, for all different uh, infectious diseases, you're used to prescribing antibiotics. Well, when I saw these patients with these different conditions, I told them, listen, I just came back from a conference. I'm willing to place magnets on you, and let's see if I can, help your body heal with the magnets. And I pulled out my notes on respiratory issues and urinary tract infections, and I started placing magnets based on the notes I took in the class, and they started getting better without the need for prescription medication. So that simply blew me away, and I had to, do it more often so that I could convince myself and realize that, wait a second, this wasn't a fluke. This wasn't just the first time. It wasn't the second time. And finally, after about testing it on 12 different urinary tract infectious patients where they would come in complaining of a UTI, I would have them go to the lab, drop off a urine sample, get that analyzed. Meanwhile, they'd come back that same day and I would do biomagnetism on them. And if I found E. coli or protease or Klebsiella, whatever infection I found, that's what 3 days later would come up on their urine culture. And so it was absolutely amazing how through biomagnetism, I was able to confirm and take care of their urinary tract infectious issue without the need for antibiotics. And once again, I have done research as an undergraduate, and I began my research as soon as I got back from the conference, and I had to prove it to myself with regards to all different types of conditions. And over the course of 2 years, while I was still in Columbia, I asked for patients to bring me a CAT scan and ultrasound, MRIs, blood work, you name it, as I saw their values normalize. And so I realized, wait a second, um, the majority of the time, you don't need medicines to help the body heal. You need to change lifestyle. You need to get rid of certain toxic substances. You have to change the nutrition. You have to change the mental, emotional state of the individual. And obviously, apply magnets to help all that come back into balance. Just like people that join a gym and start to exercise. Well, the more you exercise, the more you can lose weight, but you're not going to lose weight if you continue eating the hot dogs, hamburgers, pizza, and eating late at night. So, without there being a combination of lifestyle changes and detox processes, then, as much as you place magnets, the body's not going to change overnight and not that much. But once you start going into alignment with what the body wants, and you figure that out through the bioenergy work of biomagnetism, then you can hit home run after home run and miracles begin to happen.
Yeah. And boy, do they. Boy, do they. Now, you had your own experience with knowing that it worked for you, right? And you took part in
Yes,
a study in Africa as well.
correct. And um, I realized that it worked for me when during the course, Dr. Goyce asked who here has an arm or a leg that's longer or shorter than the other one. I was the first one to raise my hand because my right arm was longer than my left for my entire life. And so he got me up on stage. He placed two magnets on my body. And within less than 5 minutes, my arms were even ever since. And
Wow.
so that blew me away there and then because I would be lifting, weights at the gym or doing lat pull downs. And if an arm is longer than the other one, it would just always feel uncomfortable. And as soon as I got back to Columbia and hit the gym, I was like, oh my God, this feels normal. I no longer feel weird lifting weights. And, you know, today my arms are absolutely even length. And all I had was a pH imbalance in the left shoulder that caused a small but significant contraction that made it appear as if I had one arm longer than the other. So that blew me away there and then in the course. And then later on, after having traveled from Colombia to the United States, setting up my biomagnetism practice in 2013, I visited India and I caught malaria while I was
Mm,
there. Both my wife and I did. And so upon our return, we felt completely ill for 4 days. We had an achy body, we had the chills, we had night sweats, we had brain fog, we had arthritic symptoms, and we both slept 20 to 22 hours a day for 4 days. My wife asked me, honey, just place some magnets on me. You can do it. And I said, all I want to do is sleep. I don't have the mental capacity to do this therapy on you or me. I wouldn't know where to begin. I have brain fog. Up until that moment, 2013, I had heard people complain about brain fog, but I never really got it. I thought, they're feeling a little off
mm,
mentally. But now I understand when you have brain fog, you cannot think straight. You just can't make an effort to do anything other than, simple tasks or chores such as brush your teeth. But somebody asks you to, coordinate a meeting or schedule something in the calendar, it's like, oh my God, that's too much. And
right.
so um, I understood. And so for 4 days, we just slept. And finally, on that uh, fourth day, when I woke up, I realized I was thinking clearly. And I told my wife, honey, let's go downstairs. I can now do the therapy. Like my brain is back. Somebody hit the light switch. So I was able to do a full therapy on my wife, and I detected pH imbalance issues related to malaria. And it made perfect sense because we had just come back from India. And of course, we were bitten by mosquitoes. And as soon as I placed those pairs on my wife, within 15 minutes, she felt amazing and said, honey, I feel great. My chills just disappeared. My brain is back. I feel like I could run a marathon. I'm so pumped and full of energy. And I said, all
Wow.
right, great. Get off the table and put those same exact pairs on me because I'm starting to feel fatigued, like my energy is now draining. And so she did. And I then felt amazing. And then we ran up the stairs and we told my in laws that were there helping us, we said, I'm taking everyone out for dinner. I figured it out. We picked up malaria from the mosquitoes while we were there. And by stabilizing the pH balance in different areas of our body, we were able to boost our immune system so that the malaria was no longer affecting us. And that was the end of malaria in my wife and myself uh, for many years to come. And so, give me 1 second. And so, fast forward 2017, I tell my wife, I've been detecting and identifying that many people have underlying malaria in their sessions. And I feel that if I could go to Africa and work with actual malaria patients, I, might discover something new, or it might bring it all together and I could prove that this actually works beyond just working for you and I. So my wife recommended, you should write a blog post, honey, and put it up on our website and see if it catches any traction. And so I wrote the post, and 6 months later, I was contacted by the um, head of a mission organization in Oklahoma.
Mm,
And he said, I read your blog post on malaria and biomagnetism, and I'm heading out to Kenya in about 6 months. Would you care to join us? And you could work on malaria patients while you're with us. And I said, I would love to do it. And, it sounds like an amazing opportunity. So in 2018, we went during the summer and we were able to work on malaria patients. And we identified that they had malaria through antigen testing, as well as blood smears, as well as physical exam. And so they met all three criteria of physically observing the parasite underneath the microscope, as well as having the symptoms, as well as having a positive protein antigen assay test. And during the following several days, I placed magnets on those individuals, and we had them come back 72 hours later, and all but one tested negative. The individual that tested negative, we had her, I applied biomagnetism session on her again. She came back 3 days later and she tested negative. And so
Wow.
all symptoms were gone, the antigens disappeared, and the malaria parasites underneath the microscopic slide also disappeared. So that was a small pilot study that unfortunately was not statistically significant enough for publishing, but nevertheless, it was enough for me to convince myself, as well as all of the staff at the clinic, that clearly it was working.
Yeah. Wow. So before we get too far into this, explain what biomagnetism therapy session is like. Like, what is it doing to the body?
Absolutely. So, a biomagnetism session is about, for the first several minutes, having a conversation with the individual to understand what health issues they're going through, so that we as a therapist can understand where is their body out of balance. And after we write a few notes down based on what they tell us, we then have them lay on a table, usually a massage table, and we go to the edge of the table where their feet are hanging, and we proceed to do muscle testing. And so the muscle testing is a technique whereby if you place a magnet on an area of the body where the pH is off balance, where there is inflammation, then it will either cause a muscular contraction or a muscular relaxation, or simply nothing happens if the body is in stable pH. So, by observing the muscular contractions and relaxations in the individual's legs, we can tell as therapists how much inflammation there is and where there is inflammation. So if the individual just drank a glass of wine and you place a magnet over the liver, well, one of the legs will absolutely contract because the liver has now become inflamed or congested, um, and the body will show that. And so by being able to evaluate where the individuals have those pH imbalances through the observation of the contractions and relaxations in the legs, the therapist then places magnets, either reds or blacks, on the body to restore balance. And so the entire session uh, can last anywhere from an hour, hour and a half to 2 hours or more, based on the experience of the therapist and based on all of the different health imbalances or issues of the client. And then at the end, I personally like to give them a small summary of what I found and make certain recommendations, such as, based on the inflammation I found in your gastrointestinal tract, I feel that you're overdoing it in the carbohydrates, and perhaps there is an excess overload of sugary foods, and that can allow yeast to overgrow and cause certain other issues that you've been complaining about. So if you want to heal your body, it would be ideal to either cut back or refrain from eating certain foods. And so everyone is different. And, we are exposed to viruses in the air. We're exposed to fungi and yeast from our food or the environment. We're exposed to bacteria from food. Leafy greens get contaminated all the time. There are callbacks of leafy green products because of salmonella toxicity or contamination, E. coli, listeria, you name it. All of these usually come from the irrigation systems. So if
Mhm.
there's a leafy green farm next to a cattle farm, and unfortunately some of the wastewater from the cattle farm or the waste goes into the air, well, it makes its way to, clean water systems, but it contaminates them. And then the lettuce and the cabbage and broccoli is irrigated with contaminated water, and then that goes out to market. And before you know it, there's a recall on certain products because of those contaminations. And
Yeah.
so, based on what we're eating, we can become contaminated with bacteria, virus, and parasites are also a major player that people don't consider because in organic foods, oftentimes manure is used. And so manure contains parasites. And, if you don't wash your produce well enough, you can unfortunately ingest parasitic eggs. They are microscopic and they will develop in our bodies and cause digestive issues further down the road. So, we are what we eat, and we just have to be a little bit more careful. And thanks to biomagnetism, we can identify certain areas of the body that have more or less inflammation, and some pathogens can cause more or less inflammation in the stomach, in the jejunum, the duodenum, pyloric sphincter, ascending, descending, colon, etc. So it's it's similar, quote unquote, to acupuncture in that the entire body is viewed during a session. You analyze from head to toe, and you're working with the individual's energy. Just you're using magnets to restore and stabilize that energy so that the body can then heal itself.
Right. People ask me a lot, like how do we get parasites? And you mentioned, lots in the products that we consume. And I've seen a lot in I'm Asian, eat a lot of sushi. Not anymore because you can get parasites from the raw sushi, but also I've found it in beef.
Absolutely. One particular, I think he was 5 years old at the time, child that I saw, I detected a certain parasite that's in sushi. And once again, I can't say that I saw the parasite. No, simply I observed certain imbalances in his body that were suggestive of there being inflammation in that area. And this particular parasite can cause inflammation there. When I inquired as to does this child eat sushi, the mother said, no, absolutely not. To which I responded, it's interesting because it's as if he's been exposed to parasites that live in fresh water, lakes, rivers, streams. Then she mentioned, well, we do live on our lake house and he's in the lake every day,
Mhm.
swimming and splashing around. And so it made perfect sense as to why I found the inflammation in that particular area. And after the therapy, upon uh, having an update as to how her child was doing, all of his symptoms disappeared after the session.
Wow.
And so, not everyone needs to have a control before and a control after and expect labs to show everything that is observed. simply with a clinical improvement after placing the magnets, that's good enough. And so in the future, I would love to do more in-depth research and, get some very complex labs and analysis um, for each client before and after. But for now, I'm content with clinical improvement.
Right. Well, what are I would like to know, and I'm sure lots of people would like to know, what's your opinion on the major rise in chronic health issues that is going on? Things like chronic fatigue, Lyme disease, fibromyalgia, arthritis, and even the mental health disorders. What's your opinion on why it's such a steep incline over the last couple of decades?
Um, Personally, I believe a lot has evolved since 1986. That was a special year, uh, but at the same time, we have, as a global community, been involved with more toxins than ever before. We dump our sewage into the ocean. We contaminate the ocean with mercury. And so when we go ahead and eat seafood, we're simply ingesting all of the mercury that we've dumped into the ocean. So we become toxic with mercury because of our own fault. And so it's frustrating and it's sad to know that we are spraying our fields with all of these harmful pesticides and chemicals and trying to kill off um, all of these insects and uh, other pathogens that affect our crops, yet those same toxic substances are then toxic to us. It used to be, I believe, about 30 years ago, when mothers were tested for chemical substances in their bodies when they were pregnant, there were maybe 30 to 50 chemical substances found. Today, on an average, there's over 150 chemical substances found in very high levels in all pregnant women. And it's unfortunate, but that pregnancy glow that women experience during pregnancy, it's actually due to the unborn child absorbing all of the toxins from the mother. And so, yes, the mother is taking increased B complex and multivitamin support and prenatal multivitamins. But beyond that, the mother is becoming healthier because the child is detoxing her of the substances that are
Mm,
going through her body. It's very difficult today to lead a healthy and clean lifestyle. You have to spend so much more on your food and you have to limit where you go out and what you eat because, once again, 50 years ago when our grandparents were around, they could fish in the streams and the rivers and they could go to the local oceans easily. They could go for a dip every summer. Now in the Jersey Shore, because I live on the East Coast, I think there were at least 20 or more beach closures because of
mhm.
E. coli and other fecal bacterial counts that were excessively high, so high that it was a risk to everyone's health. So the beach was closed on certain days of the week because the fecal material counts were too high. Why? Because we're dumping all of our sewage into the ocean, and the currents are simply bringing it back. So, unfortunately, once again, the steep rise in health issues are the toxins that we're exposed to, as well as the warmer climate that we're experiencing. Climate goes through waves, and so we're currently in a wave that it's warmer than usual, which allows for mosquitoes to not only reside near the equator and further north, like Florida, but they can live as far north as Connecticut, Massachusetts, even up to Canada sometimes. And so if a mosquito bites me and I have Bartonella or malaria or dengue, and I'm in South Carolina, then I come back from vacation to the New York area and another mosquito bites me, then it bites somebody else a week from that day. That other person picked up whatever I picked up in South Carolina,
Wow.
and it
Yeah.
just spreads exponentially. So no one's going to consider that they may have dengue from a local New York, New Jersey mosquito. And so it's not that the dengue mosquito is in New Jersey, it's that I traveled south, picked it up, brought it here, it was in my blood, and then it got transferred.
Right. One of the questions I had for you that I was very curious about, because it's not often addressed, is Epstein-Barr virus. And a lot of people, they know Epstein-Barr causes mononucleosis, but in later stages, when it mixes with other pathogens and it's dormant in the body, suddenly gets reawakened. It can cause a lot of things people don't realize, like mental issues, right? Can you talk about that?
Sure. So whether it's Epstein-Barr cytomegalovirus or other viruses that can affect the central nervous system, if you only have one virus, it may not be that aggressive. But when you start adding on other infections, because your immune system is down, because you're stressed out, because you've been staying up too late, because of work, because of whatever issues, as your immune system becomes taxed, then these different pathogens can come up out of the woodwork and start to wreak havoc on your body. And unfortunately, conventional medicine doesn't have a solution for viral or other pathogens attacking the body. However, with modalities such as exercise, meditation, biomagnetism, you can start to move your body in the right direction so that it heals itself. So everyone knows that from exercise, you get greater oxygenation, you eliminate more toxins, you improve circulation. Biomagnetism, I feel, does exactly the same thing in a very different way. It's much more coordinated and focused. So if your right knee is hurting, well, you can place several magnets on the knee and elsewhere, perhaps the bladder, to help drain the inflammation, just like you place an ice pack or you place heat in order to bring the inflammation down and control local inflammation in the area. You can do the same with magnets. It's a very focalized, coordinated response with the body, and it's something that clearly needs to be studied more. But as soon as you have a pain and you start to use the magnets, you realize, wait a second, something is happening. I am feeling a change. There is a positive benefit to this. And so I invite everyone to, consider biomagnetism and test it for yourselves. And once you do, you'll realize, wait a second, something's working. I do feel a change. This is quite extraordinary. And with nutrition, if I have a pain in the right knee, it's not like I can eat broccoli, which is alkalizing, and the pH alkalinity of the broccoli is going to go down to my right knee. Nutrition does not work that way.
Right.
But using the magnets, you can focus it in that way. And just like exercise, you can rehabilitate and do exercises to bring back strength to your leg. So biomagnetism is very similar in that respect.
Biomagnetism can be used to put focal energy up in the brain as well. Is that right?
Yes, Once again, with Epstein-Barr, going back to that, Epstein-Barr causes so many neurological issues, fatigue, mood swings, sleep disturbances, personality changes. Ultimately, it causes a lot of inflammation in the brain. And so, if you use magnets or magnetic fields, you can restore a lot of that balance to the brain, and individuals will begin to feel certain positive changes. It doesn't happen from 1 minute to the next, but it happens gradually over the course of several sessions. And so, it's about giving your body the right tools to help it heal itself. Um, one analogy I love to use is a swimming pool that you haven't had the swimming pool open all winter. Spring comes and you say, all right, I want to start swimming in it. You take the cover off and the water is brown and murky. You'd never want to go swimming in that. As soon as you stabilize the pH, you add in the chlorine, you add in the sodium bicarb and stabilize it, the water becomes clear. And kids can, pee in the pool, poop in the pool by accident, and keep the chlorine and the sodium bicarb going. The pH is going to remain stable. And that pH stability does not allow for infections or viruses and bacteria to thrive in the swimming pool. So if we maintain our body's pH in the right levels, in the right organs, it's very difficult for viruses and fungi and bacteria and parasites to survive in our body. It's about getting to know our body and giving it the necessary conditions for it to be able to heal itself. And last but not least, I mean, when a person comes down with a respiratory virus, um, everyone would always say, and it still holds true to this day, stay home, get rest, sleep in, and drink grandma's, chicken and vegetable soup. And so you're doing the right nutrition, you're resting, you're not being stressed out, um, you are giving your body an opportunity to heal itself.
Mhm.
That's what biomagnetism allows, the opportunity for your body to heal itself under the right conditions.
Now, when you have someone that is struggling with something like Lyme, I know there's a lot of misconceptions about Lyme and how to address it because it does do a lot of the same things that you talked about with like malaria, right? The brain fog and the pure exhaustion and the muscle aches and a lot of people that I know that have struggled with Lyme, they start to feel hopeless. Is there hope in using biomagnetism for someone that's struggling with Lyme?
Absolutely, there's hope. And as I mentioned, a lot of the symptoms that my wife and I experienced with malaria were very similar to the symptoms that individuals with Lyme experience. And so, Borrelia burgdorferi, which is classified as the typical bacterial infection that causes Lyme, unfortunately is not the only bacteria that causes Lyme. There's Babesia, and Babesia is a cousin of malaria. And so
Mm.
Babesia hides in the red blood cells like malaria does, and it causes fatigue, it causes brain fog, all of these things. And Lyme, oftentimes, individuals with Lyme have many co-infections. Those with Lyme will understand this because on their labs, they test positive for Bartonella, for Mycoplasma, for Epstein-Barr virus, for the Borrelia. They will also test positive for Rickettsia, for tularemia, for Borrelia lone stari, et cetera, et cetera. So everyone, unfortunately, in the medical world feels that, oh, you just treat Lyme with an antibiotic because all Lyme is one bacteria. They don't realize that Lyme is about the co-infections. It's not just about one infection, it's about the layers of many infections. And so, if you have underlying Epstein Barr virus, which causes mononucleosis, which is fatigue and brain fog, on top of, say, malaria or mycoplasma pneumonia, well, you're going to experience achiness and stiff joints and the other symptoms that those also come with. So, expecting to be on one antibiotic and being able to take out Lyme, no, it has to be a multifaceted approach where you're doing certain things to boost the immune system to help it with viruses, another thing to help it with bacteria, another thing to help it with parasites, because malaria and babesia are parasites.
Right.
Lyme Borrelia is a bacteria. So, to try to just consider antibiotics and painkillers and say to the person, you have to get used to it. And, you know, there's nothing else we can do. It's absolutely the wrong approach. You need to understand that it's about layers of many infections that need to be dealt with, um, from session to session and through a coordinated effort, combining with detoxing your body, combining with adding in certain supplements and cleaning up your lifestyle.
That was going to be one of my questions. So I'm glad you brought that up because diet and lifestyle change is part of the healing process. It's not it's not like you can just do magnets and it's one and done and you go out and eat trash again, drink trash again and think that your body can hold up. So I'm glad that you mentioned it. You are a pioneer in biomagnetism therapy, and I'm curious to know what you think is going to unfold in the next 10 years in the field. Uh,
Great question. Give me 1 second. Okay. Thank you for the great question. And I honestly would love to see biomagnetism explode around the world. I believe this is a therapy that should be available to everyone in the world. It is simple. It can be complex, of course, but it is natural. It is not harmful. It can be practiced by anyone. It doesn't take an astrophysicist to place magnets on the body to stabilize your body's pH and allow for the body to then begin healing itself in different ways. Much like people can use cold therapy or heat therapy, massage therapy. We all recognize how beneficial a massage can be to whether it's a lymphatic drainage massage or a muscle relaxing massage, you name it, it's very beneficial. Biomagnetism will also move lymphatics around, will also increase circulation, will also drain inflammation. And so I would love to see it go global, be accepted by mainstream, be accepted in the hospital system, be accepted by the holistic and alternative community of chiropractors, acupuncturists, um, massage therapists, and other healers. And it's something that, once again, can be very simple, yet at the same time so powerful because you're identifying where the body has an issue and you can do something about it, whether it's identify that, you know what, my abdomen is hurting and it's probably because of the chocolate that caused an excess inflammation to the liver. I place a few magnets on the liver, I stimulate the liver to normalize and restore its function, and my abdominal pain disappears. Therefore, I've learned, wait a second, if it was the chocolate bar that caused the pain, and I placed the magnets and the pain disappeared, then I guess I shouldn't be eating that chocolate bar anymore. And so by identifying certain triggers and foods that are not in line with your body's energy, you can start to lead a healthier and cleaner lifestyle.
Absolutely. Well, you offer comprehensive training in biomagnetism here in the US, but also globally because you offer it online as well, right?
Yes.
Where
Uh,
can people
during
find out about it?
Thank you. So if you visit my website, drgarciabiomagnetism.com, we have all of the information there available where you can see when my next in-person training seminars are, as well as you can sign up for our on-demand online training seminar, which you'll have access to for 12 months or more. You can decide afterwards. But it was during the pandemic that I realized, wait a second, if people cannot come overseas because of restrictions and other issues, then maybe they can at least watch it online and learn there. And fortunately, our feedback has been that plenty of people have received training online, felt empowered enough to begin placing magnets on themselves and family members and realize that, wow, yes, it's working. And they're getting results, feeling it for themselves and their family. So we are just, you know, uh, overjoyed that people have realized how powerful the online seminar is. And you get a
I'm
year
one
to
that
go
took
over it.
it. Yeah, I did the online and just stumbled upon it because I was looking for something to add to my alternative practice. After one of the modalities I did wasn't working anymore. And I can say from personal experience, it's so in depth, it's so comprehensive. And the fact that you get to go back and watch for a year, if you've forgotten something, and I mean, I filled 2 notebooks taking the course because it was so interesting to me. And I watched the videos multiple times. You are so good at teaching. And I want everybody to know that. Like, you're very clear, you're very generous with your information, even in the online class. And yes, it's a long course, but you can get through it and start to place magnets immediately. And the results are phenomenal. So you see clients as well? Do you still have an practice here in the US?
I do, however, I practice in New Jersey 3 days a week, in New York 2 days a week. My New Jersey practice is now closed to new patients because I have a 6 month wait list. And so, in order to keep those that I already see, I cannot take on any more in New Jersey. And in New York, it's a 3 month wait list. Once that gets to 6 months, I'm closing that out and I'm going to be referring clients to all of my practitioners that are now spread around the world, fortunately.
Yeah, it's
So,
wonderful. So if you're interested, I suggest you visit his website, Dr. Garcia Biomagnetism. Is that right? The
yes,
website?
Dr. Garcia, biomagnetism.com.
Yeah, awesome. Dr. Garcia, it's been such an honor to spend time with you. And thank you, thank you, thank you for the valuable information that you have shared today. You're doing important work. And I believe that it can revolutionize the health of the whole entire world if they embrace it. But I have hope because if you think back to acupuncture, chiropractic, it took years for it to be accepted. And now it's a common thing and it's covered by insurance, right? Biomagnetism is not covered by insurance, but it is effective.
I absolutely agree. I am very optimistic. I know it will take years. Um, And, for now, I'm leading the charge, and anyone that wants to help and come along, more than welcome. And I love the fact that you took it online last year and you've been experiencing great results. And out of curiosity, if you could name, say top three or top two experiences that you've had, I'm curious.
I one of the first clients that I worked with, and I've known her for years, but we kind of drifted apart. I did a YouTube or a Facebook Live about my experiences with biomagnetism, and she literally said to me, and we did a whole interview with her after the fact, but she said to me, "My will is done. I'm so sick. I know I'm dying." She had dropped down, she's 5'8", dropped down to about 114 pounds, and she just was not getting well. Her doctors were telling her there's nothing more we can do. She had reflux, she had her gallbladder out last year, she had so many different things going on, and she could barely eat anymore without stomach pain. And it took some time and different sessions, but she even had nerve pain, neuralgia down her left side of her body, and facial paralysis off and on. That was at a 9 when we started. And I am happy to report it's down to a norm of a 1 in a matter of months. And all of those other conditions she was struggling with, and all the medications for the reflux, for the constipation, for the arthritis, for on and on, gone. So yeah, she's my favorite one. The other one that I just finished working with, and it didn't take very long at all, but he struggled for 14, 15 years, 112 hospitalizations for something they said was genetic, within his stomach. They removed part of his stomach, and he was on hydrocodone for a
Mm-hmm.
number of years. He finally took himself off, came to me, he trims my dog's nails. He came to me one day and he started telling me, do you have any suggestions? I said, I think I can help. Come in and see me in my office. One session, for the first time, no pain, no exhaustion, no brain fog. Um, but I had talked to him about changing his diet, and he was 30 something years old. I don't know if I can. Right. And he had had a hockey accident prior to all of his stomach issues blowing up. He just got a virus and it just blew up and they couldn't figure it out. So he had a brain injury as well that knocked him out. 3 sessions, finally changed his diet, because the first session he hit that just, oh my God, I forgot what it felt like to feel normal. Right. But then he went back to his diet and washed it out. Said, all right, come back in. But this time I'm telling, just try it for 30 days. The diet recommendations I gave to him, just try it for 30 days. Second session, got him back to a 0 on his pain level. Stomach was fine, made the changes. And he was down from 185 pounds when he first got sick. He was down to 120 pounds. He was fading away. I mean, it was not looking good.
Right.
He is
Sure.
up to, and it's been 3 months, he's up to, he just sent me a text yesterday, 152 pounds, all plant-based. He's all plant-based now. No pain, no
Beautiful.
exhaustion. He's asked me to go skydiving with him, which I don't think so. And he's going back to play ice hockey after 15 years of not, because he was going to go pro when all of this happened. He hasn't skated in
Wow.
15 years and he's going back. And I think it's the best part about it. He's a dog rescue person. So he's saving dogs all the time, constantly. And he's finally gotten his health breakthroughs. And he didn't think he'd ever be normal again.
Oh, beautiful.
So,
Excellent.
yeah.
Thank you for, you know, opening your mind to this. I'm so happy, I mean, beyond happy that you took it seriously and you said, you know what? I've been doing something else for 15 plus years, but I'm open to this. Let me give it a try. And now you're all in, clearly.
Oh, yes. Yeah. And it's easier. I mean, you need electricity and a laptop and a whole machine to do what I was doing before. Now I don't need any of that. I don't need electricity. I carry magnets everywhere I go. Usually I'm wearing some, but everywhere I go,
Yes.
my granddaughter, we were at dinner one night and our food was going to be delivered and she looked really sad. And I looked over and I was like, what's going on? My teeth hurt. I was like, oh, hold on. And I just pulled out a pair of magnets and I said, put this over on your tooth. You just hold them there for a couple of minutes. Let's see what happens. And right before the food came, she pulled them off. I said, "How's your mouth?" She goes, "It's weird, Grandma. It doesn't hurt." She ate her dinner. It was like it never happened. Simple, just simple.
Right?
Yeah.
I mean, some of the things are so simple and it's just beyond amazing.
Yeah.
Absolutely.
Yeah. I mean, our
Yeah.
family has benefited greatly. My dogs, even my dogs have benefited. And it's one of the reasons I think that I was able to buy in so easy. I used to train horses in California years ago. And
Okay.
we used magnets for rehabbing the horses anytime they had any kind of an injury. So it wasn't this huge belief leap to me about, okay, magnets can work, right? It already experienced it. We always used it on the horses while they were recovering because it was race horses and show horses, jumpers. Anytime they had an injury, what do? You soak their feet, you soak the area, and then you put on some sort of magnetic therapy. And
Oh, okay.
yeah, and I mean, golfers use magnets in a lot of their braces and whatnot. Different athletes use magnets. So
Absolutely.
the understanding of how can it work wasn't such a leap because we've already been using them, just not to the capacity that biomagnetism does. Yeah,
Yes.
yeah.
The
So
whole pairing of the magnets makes a world of difference. Once you understand that the body can guide you to, do you place the magnets like this or like this? Placing them in the proper positions and the right color, that makes a world of
I
difference.
can attest to that. I did place some magnets on my dad one night. He was having some cramps going on in his body. So I started placing magnets. Well, he was sitting in a laying in the recliner, and I don't know what I did, but I put the pair in the wrong direction. Right, it was going down from his gluteus down his leg, and all of a sudden he started getting cramps down his leg. Worse, he goes, "What are you doing? What's happening?" "I'm not doing anything. Hold on." And I backtracked. What pair was it that it started? Pulled that pair, reversed the direction. It was fine. It was perfectly fine. So, yeah. And I think that's an important part for people to understand too. Because I had someone that I'd done a session on, went out and bought a book online on Amazon and just started placing magnets. I said, well, there's an important aspect here of knowing where to place them and how to scan for that, right? That you cover extensively in your training, how to scan, how to do a whole scan, not just a partial scan, not a magic pair scan. That's important for people to understand. And that's why I think they need to get that education from you.
Absolutely. When you are properly trained, then you know exactly where and how to place as well as why you're placing the magnets. The good thing that, I mentioned with regards to placing the magnets is if you place them in the wrong position, simply nothing occurs. You won't get the benefit, but with your father, he was getting cramps regardless. You placed them in the wrong position. He continued getting the cramps. That's why it didn't go away. So it's not going to make things, worse. It simply won't get them to heal appropriately. So once you inverted the polarity, then probably within minutes or less than a minute, he felt the relief.
Absolutely. And it did not amplify. What had happened was when I placed the first sets, it went away. Then I placed that set inverted and it amplified again. Changed it, absolutely gone. So yeah. It's
Yeah,
important to be trained. So if you really want to be trained, I would say go to the best. And I looked at a lot of there are other programs, but
correct.
I am one that does due diligence. You know, if I'm going to get trained, I want to be trained properly. And you were my go to. And I'm so glad
Thank
I
you.
went that path because I have talked to a couple other people that looked at some of the other courses that are either do it yourself courses and they're very inexpensive, not comprehensive. Dr. Garcia's training is very, very comprehensive.
Thank you. And, that's what I wanted to do from the beginning. I wanted to give this the most seriousness and professional point of view and approach so that everyone could take this seriously. I didn't want to be considered a quack or, he's just playing around with magnets. No, this is a very direct, simple, um, powerful approach that when you take it seriously and you start to apply them, miracles happen. And
Absolutely. Big miracles. Yeah. Well,
yes,
Dr. Garcia, do you have any parting words of encouragement for someone listening that feels like there's no hope for their condition?
absolutely. Give biomagnetism an opportunity so that you can reclaim your health. And it's unfortunate that others say there's nothing left that can be done, but there is so much that can be done. You just need the right tools. And oftentimes it involves making lifestyle changes so that it is congruent with what your body wants to do. So, you and I have experienced plenty of clients that we tell them, listen, I feel that you have an excess inflammation from dairy consumption. And so if you can, cut out the dairy, that will benefit you. I'm not giving up cheese, right?
Yeah.
Or
Eggs, cheese, bread. Yeah.
ice cream, you name it. And so once you go ahead and you start to taper down on all that and you realize, wait a second, I'm not gaining weight. My face isn't breaking out with acne. My abdomen isn't distended. I'm not feeling bloated. And all these other changes start to occur. You're like, oh, I guess the dairy was, causing me inflammation. So, yeah, I feel that there's always hope, and biomagnetism absolutely changed my life over 15 years ago. And if you give an opportunity, it should be able to change yours. So, thank you
Awesome.
very much.
Such valuable information shared with all of you today on the Gold Factor podcast. Please share this episode with your family, with your friends, because you don't know who might be silently suffering that's going to benefit from the important information that was provided for you today. Follow the channel, leave us a comment, and let us know what you learned. Or if you've had an experience with biomagnetism, put it in the comments and let other people know your experience. Until next time, friends, you have greatness within you. Summon it. Be blessed and be a blessing.